I'm Dr. Leah Austin. I'm a GP and a nutritionist. I studied nutrition because within the NHS as a GP I felt that I was more service provision and that when I gave a medication I may take one problem away but then gave another problem. From my experience as a doctor looking at medication, there are certain side effects. For example, an anti-inflammatory medication such as ibuprofen that you can buy over the counter can have side effects affecting your kidneys, affecting indigestion, causing heartburn and a gastritis type symptom in the stomach. One of the difficulties in medical practice, in general medical practice, is chronic pain. The conventional medicine slide is a medication ladder. We call it an analgesic ladder. And once you get on that ladder, people don't tend to go down, they tend to go up. People end up on multiple medications. There's two different types, one anti-inflammatory and the other one opiate-based medication. And then people are on these regular prescriptions and regular medications, generally for life, to manage pain. And I've wondered whether there was a different way. It brought me to looking at other options for pain and treating pain. NuroKor, it's an interesting treatment option because it deals with something that's completely natural in the sense that it's not giving your body anything except for electrical current. There's good evidence that this can help relieve pain. It's to do with the pain pathways. The pathways to the brain, you need to change that signal and to learn how to treat it in a different way. And with medication, you get the side effects. And looking into NuroKor, it's a different way of treating that pain without the side effects. It has two elements to it. It has neuromuscular stimulation where it stimulates the muscle. That can be used not just for pain, but also if you're losing that muscle bulk, if you're an elderly person as well, is stimulating that muscle to move. It can actually do that to prevent muscle wastage, which is brilliant. The other aspect of it is using it as a microcurrent where your body's made up of molecules, we know positive and negative, and using a microcurrent, which you don't even feel on the skin where the pain is, can actually reduce the inflammation and reduce the pain in that area, which is really amazing that this technology actually exists. I invested in NuroKor because I see the potential. It's a great technology and it goes away from the normal medical conventional role. I like the aspect of no medications and something that's natural. It has a lot of potential, the future of bioelectronics. The way that you use it, it can become very personalized with understanding how your body is working and registering that and taking that data and then personalizing it back to you. It knows what you need. I definitely think that more and more evidence is becoming available for its use. People are using it now for helping them relax in the evening, for anxiety, for sleep. Those pathways in the brain and also in the body, they're all currents throughout the body, so the nervous system. So it's going to make a huge difference. It's very rare these days where you come across a friend or anyone, even one of my patients, who hasn't had pain in some sort of way. So there's always an opportunity to be using NuroKor or bioelectronics to help manage that pain. If I can get and plant the seed to patients that there is another option and it works, can think of the profound effect it will have on their life. So I'm very excited going forward to get more people using it. I can see more and more doctors going down this route to treat their patients with pain because it's such a good opportunity to avoid using medication and medication overuse. Also to avoid the tolerance of medication, needing more and more painkillers to treat that pain ladder and reducing that. So the opportunity for medical doctors to use something else other than medication is unbelievable.